Cervical spondylosis is a degenerative condition of the cervical region of the spine. This pathological condition can include facet joint osteoarthritis, bone spurs, or disc herniation. Cervical spondylosis causes narrowing of the vertebral artery canal and spinal canal, which compresses vessels and nerve structures. These changes can cause neurological symptoms. %90 of the world's population over the age of 65 has cervical spondylosis, but few people have symptoms of this condition. The cervical region of the spine is made up of 7 vertebrae, which are designated as C1 through C7. The cervical region of the spine is very mobile. The mobility of the neck is ensured by the facet joints, the intervertebral discs, and the spinal ligaments. Cervical vertebrae are different from other vertebrae because they have holes in the transverse processes called transverse foramina. Arteries, which supply the brain with blood, come from the neck through these holes. The cervical region of the spine is curved forward. This curving helps to absorb pressure, vibrations, and shock that occur with movement. The first and main symptom of cervical spondylosis is pain in the neck portion of the spine. It occurs due to compression of the spinal cord and nerve roots from disc herniation, bone spurs, or thickened ligaments. In most cases, the pain of cervical spondylosis increases with movement. The reason for this phenomenon is compression of nerve roots during movement of the cervical vertebrae. Pain in the arms may be a symptom of cervical spondylosis. It occurs due to compression of nerves that extend into the arms through the neck portion of the spine. Besides pain, cervical spondylosis can cause weakness, numbness, and cramping in the arms. These conditions arise due to nerve compression, too. In severe cases, cervical spondylosis can cause compression of the spinal cord and difficulty walking, loss of balance, and impaired coordination. In very rare cases, when cervical spondylosis causes compression of the spinal cord, bowel and bladder incontinence may occur. In most cases, cervical spondylosis occurs as a result of degenerative changes in the spine during aging. Intervertebral discs become dry and thin around the time you turn 40. Disc degeneration can cause herniation, one of the signs of cervical spondylosis. Aging in the cervical region of the spine also can lead to signs of spondylosis, such as bone spurs on the vertebral body or facet joints. With age, ligaments that bind the spine together become thickened and stiff. This condition also can cause symptoms of cervical spondylosis. Usually, cervical spondylosis occurs in older people, but some factors can contribute to its development early in life. One main cause is an injury to the cervical region of the spine. Holding your cervical spine in an uncomfortable position for prolonged periods can contribute to the development of spondylosis. Many scientists believe that cervical spondylosis is a genetic disease, which children inherit from their parents.